Welcome to the Law Enforcement Community Engagement Committee's monthly presentation. Today, we're happy to have as our speaker, Mary Beth Mitchell from the Maine State Police. Mary Beth is the Behavioral Health Coordinator assigned to Northern Field Troop J, assisting with a broad range of social concerns in Hancock and Washington counties. And here to explain more about that is Mary Beth Mitchell.
Hello, everybody. Thank you for having me. It's always nice to be able to do a little bit of promotion for the program. The Maine State Police Behavioral Health Program is fairly new. We just turned a year old. There are 5 of us statewide. I cover Hancock and Washington County. There is someone that covers Southern Field Troop. We have someone at Central Field Troop. And we have someone in Penobscot County doing another liaison position within the Northern Field Troop, but because we cover so much area, there are 2 of us. And then we have another person that's embedded in Aroostook County. And so this position is evolving as we become familiar with the needs of the community, as well as how we can best serve both the troopers we work with and the community members. My job is a little different than Melissa's. I'm not a co-responder. It is mostly remote what I do. Occasionally I can weasel myself into a police car and go out on a field trip, but for the most part, my work is remote. I am not trained in law enforcement. I have a social work education background. So I feel like what I can do is most effective remotely most of the time. There are certainly times when I can go out in the field and do things in person, but for the most part, I'm here at the barracks at Troop J, unless I'm off at a meeting or something like that. But our focus really is to identify and support people who have compelled a law enforcement involvement, but they may be better served through a social service agency referral or another social service that would better suit their needs. As most of the law enforcement community will tell you, there are a lot of people that call 911 and there's not always a response that involves the law. It might not be something that requires a law enforcement response, but yet that person is still in desperate need of some sort of help. So my job is to step in and to try to find the proper support for that person's needs. Our primary focus is people with mental health issues, substance use issues, elder abuse issues, or supporting people that might have been in a family fight, which is also very closely related to any domestic violence related fights. So if it's a family fight, it might not have risen to the level of an actual domestic dispute, but yet there's a lot of other social, emotional needs that could be met for that family that the troopers don't always have time to locate those resources. They're busy. They have a specific task to perform, and finding the right social service agency for a family isn't necessarily in their wheelhouse. So that's where I step in. So far this year, I've responded to or been involved in about 100 calls for service. So what I do is I take referrals from a trooper directly. They'll email me. Last night we had an incident. They'll give me the number for the CAD and I'll look it up, look at the notes, and then say, oh, here's what I can do. I'll reach out to the person. I'll try to offer them support or ask for their permission to make a referral if that's appropriate. A lot of what I started off thinking this job was has sort of morphed and changed depending on the needs of the community. At first, we didn't think there'd ever be a reason for me to be involved in a fatal car crash, but it turns out fatal car crashes are traumatic, and the survivors sometimes are just sort of traumatized and they don't have the resources to reach out to a counselor or even know where to begin looking. So a lot of times, if there's a fatal crash, I'll follow up with the victims, the families. If it was teenagers, the whole family's affected by that. There is a lot of unresolved trauma that can happen if someone doesn't get the resources or the counseling that they might need. So um, I've been involved in things like that that I didn't expect to be. There's also the straightforward, a lot of people that have chronic mental illness that call 911 because they're hearing voices or they're seeing things. The police will go out repeatedly, and then there's nothing that they can do. But there may be a resource for that person or a particular need that's not being met. So I'll try to connect them with that. Sometimes it's really effective and it's really helpful. And then there's also some people that just don't want your help, and that's fine too. But I've been overwhelmingly surprised at how appreciative people are when you call them and you say, I'm calling from the Maine State Police. I was expecting a lot of people to hang up on me or people to not be wanting help, and that's very rare. Most people are very appreciative when you offer, and it's been an interesting road to sort of see where this job is going to go, and how we can expand the program. I cold called Melissa one day because I was like, "There's another behavioral health person in Hancock County." So her job is a little different. She does a little bit of a different model than what we do, but it's really great to connect with other people who are working within your community, but also that sort of understand, like, oh, I have a need and I'm not quite sure who the best resource might be. It's great to be able to reach out and find out, what the connections are in the community. Um, Anything I haven't covered or any questions I might be able to answer for anyone? All right. Well, I could talk all day and I've been known to, so I will leave it at that. If there are no questions, I will stop and let you continue on with the rest of the meeting.
Oh, let's see what we can come up with for more, because we know you have a ton of information there.
Right.
So I'd really like to hear more about some of the, I don't know, what do you find are the challenges for your job right now?
I find one of the biggest challenges is the lack of resources available for immediate support for people that have mental health crisis. I've got one particular person that's been sitting in the ER for 2 weeks, waiting on a bed. And it's not because there aren't beds statewide. There are over 100 mental health beds, but it's the gatekeeping that happens through the hospital system. They don't have to tell us who's in those beds. They don't have to tell us how long, and they can just say, oh, we can't accept anyone right now. There's no beds available because of staffing or milieu or another reason. So it's not the lack of beds, it's the lack of resources to support the people that need to be in those places. Um, Juveniles, there's a lot of issues with juveniles and schools, behavioral issues. I find that it's sometimes challenging because a family could use family counseling, but when you make a referral, there's 6 months to a year to wait for a counselor to become available, which is too long. So that's been a challenge, but it's also good to be able to identify where the needs are so that you can make other people aware of those as well. And part of that is to try to work within the system to try to make these changes happen.
Yeah. I was just reading in the paper the other week there that Sheriff Kane had attended a session um, about post-traumatic stress disorder for first responders and police officers and things like that, and that there isn't really enough services even for those folks. So um, is it what do you think that is? Is it just that we don't have enough professionals in Maine to provide that, or?
I think
I
it's
mean,
more complex than that. I think there's more awareness. There's less stigma. So when someone in the law enforcement community has experienced too much trauma and they feel like they need some support, there isn't as much stigma about reaching out. So I think that's opened up a lot of law enforcement officers to be able to come out and say, I need help when I need help, or I need services. But also there is a lack of providers because um, the troopers that I know are wary of who they're going to talk to about their issues. They're not just going to spill it to anybody. They're going to be cautious about who they want to talk to about this. So finding somebody that's vetted and knows the law enforcement life and lingo is really important as well. Because nobody wants to go to a counselor and come out feeling worse than when they went in. And it's hard to just recommend anybody for certain types of counseling. So you got to really know who the audience is and also who the service provider is. And I'm not going to recommend someone that I don't know is trusted and has been used by other professionals. So yeah, I mean, if you're in Portland, your access to services is going to be wider than it is up here.
Mm. And I just wanted to say hi to Alicia. We have not seen you here before. Do you want to introduce yourself?
Hello, I'm a student at UMaine who actually is potentially looking at going into police force-based social work. I graduate in May, so
Oh, we're so glad you're here. That's great. And are you up in Orono, or do you get down
yes,
this way also? Or
I am in Orono.
uh-huh. Oh, that's great. Thank you for coming.
oh, it sounds like, Alicia, that you will have career opportunity.
Sweetser currently has about 12 police force openings statewide in their options program.
Mhm. Hmm. And I'm really curious, Mary Beth and Melissa, how the I don't know, interconnections, or how like looking at around the state and especially in Hancock County, trying to have more of that kind of community resource approach to issues that aren't strictly policing. We've heard in these meetings so many times about that law enforcement ends up doing, some folks who've come and spoken to us have said 90% of law enforcement has been mental health issue related. And so I wonder about how to further develop different, different departments, or trying to work with the county on some level. Like, what do you see between the two of you and how it helps expand this work?
Well, I know that 2 weeks ago now, myself and Chief Kearns, we met with a small group of people, including a pastor and somebody from the YWCA and somebody who runs the library, just like a small group of people that had shared mindset of how can we provide resources for we talked more specifically about unhoused people in our community, but a lot of almost all of the unhoused people that come through my service have some sort of mental illness, diagnosed or undiagnosed. So I know that, like, within the community that I work in, which is both Bar Harbor and Mount Desert, we've kind of, like I said, created a group of people who we've created a resource sheet for everybody to share. We have tried to find ideas on how we can provide resources to people that are unhoused or like mentally ill more as an entire community, not just on me, not just on the police department, or not just churches all working individually, more as a community effort, I guess, for the people who see the same need being unmet. There are a lot of people that go to churches looking for gas cards or hotel stays or things like that. So I was really happy to kind of witness like-minded people within the community just kind of come together to try to find a solution outside of the police department. Even though Chief Kearns was there and he was happy to be there, it wasn't just law enforcement or the mental health liaison. It was 7 people that are just community members, a part of some organization that thinks the same and has the same goal meeting. So that was pretty positive. It was a good step forward in how to get community engagement for people who have unmet needs versus just always being the police department as a fallback.
I was thinking about something that Mary Beth said about not knowing, and not knowing, but not wanting to refer police officers to somebody who they didn't know or that wasn't familiar with first responders, different culture. It is a different culture. I was in the military for 27 years, and we used to do a training that was led by Chaplain Gibson. He would put it on every quarter, and it was called, I think, Military Culture 101, and he had a 102, and he worked to help counselors understand some of the important experiences and mindset and just the way things were different from the military and civilian worlds, which is very similar with first responder culture, especially military and police cultures have a lot of similarities as well. And I'm wondering if that would be something helpful to do in Hancock, Washington, Penobscot, Piscataquis counties. Would that be something you'd be interested in? If I could get his training and then see if there's any police officers that are interested in working with one or two of us to put that together, and then invite counselors and some other people to attend that so that they're more familiar and ready to help police officers who want counseling.
I think it's a great idea. I'm a big advocate on mental health on both sides of the law enforcement community. So I think the more you understand about your own mental health, the more you're able to open up and look at different people's mental health needs in a different way, instead of it just being, oh, they're crazy. I think a lot of it is education too. The law enforcement job is not a social worker's job. And they're two very different worlds. They're two very different models of service. And I think understanding where the other side comes from will only help the collaboration. So I think it's a great idea.
And going from part of what you just said, Mary Beth, how are the officers in the state police responding to the role that you have and the other folks in your position around the state?
At first, I walked in knowing that it was like, oh, great, what's she going to do to help? So I expected a little bit of that because that skepticism kind of comes along with it. But I've been able to prove my worth by doing things that are helpful. So I'm taking the load off of them. If they have to deal with this person one more time on the phone, they're super frustrated and they're like, I've got like 3 calls for service backed up. I don't have time to deal with this. And I'm like, give it to me. I will do it. And so when you can do that and help support the law enforcement officers, and they can see that it's actually helpful and it's actually useful and it takes some of the burden off of them, I think the proof is really there. So I've had to earn their respect by doing something that's actually showing that I'm working and I'm doing something effective. You know, I could come in and do the bare minimum every day, but I'm trying to be as useful and proactive in helping and recognizing that my job is to help make their jobs a little bit easier so that they don't have to deal with the stuff that they're not necessarily trained to do. I mean, they have other stuff that needs their attention. And if this is something that I can do that takes the burden off of them, then I feel like I'm doing my job.
I agree with everything that she just said. Like, part of it is kind of taking calls that the officers don't necessarily need to take, because it's not really a crime. There's no crime that's happened. It is somebody who's experiencing extreme delusion, and maybe they need a house visit, and I can do that. I can go over to her house and, you know, make sure that whatever she feels unsafe, I can try to reassure that before I go. And a lot of it is just intercepting calls that there's no crime. There's nothing that really needs to be followed up on legally. And that takes a lot of, I don't even know if burden is the right word to use, but it takes a lot of time, gives a lot of time back to the officers to do other types of police work. And I can take the calls that are related to mental illness or unmet needs or something like that. So my situation was a little bit different than Mary Beth's, because I worked this program one day a week for 18 months. So they kind of knew what I was all about before I applied for the position. I didn't really, I guess, before I started full time, they were already prepared for me and knew what I did. But when I first came in, and even still now, this is just a really developing role within law enforcement. And I feel like it's going to continue to develop, at least for me, for probably another year. I'm only 6 months into it full time, with just that like pilot program building for 18 months before that. So we're all kind of learning together on, you know, this is my role and this is role and this is what I can do to help. And the officers are really, I think they really value, like, I feel valued anyway in my position. Like, you know, hey, Melissa, this is a call that maybe you could follow up on. Because, like I said, maybe somebody thinks that somebody broke into their house and stole their favorite hat, but I'm 99% confident that it didn't happen. So I can go over and just try to regulate that individual who's experiencing mental crisis, and it's something that the officers don't have to do.
And that brings up another question, maybe for both of you. Sheriff Kane, in a discussion quite a few months ago, brought up concerns about safety issues for the people in your positions. And I wonder if you both might be up for speaking to that.
It's definitely something that plays a part in what my role allows me and doesn't allow me to do. And it's different than Melissa's. I think a lot of people just assume that I'm a co-responder and that I ride around with a trooper. But due to the rural nature of the state police, it's not feasible for me to just ride around with a trooper, because they could be taking a call for a mental health call in Otis, and then the next minute there's shots fired in Hancock. And what are they going to do with me? I'm a liability. I'm not law enforcement. I'm not trained. You know, I've watched a lot of Blue Bloods, but that doesn't make me a safe person to ride around with. So it's a liability for them, and I recognize that. And if I do go out to respond to someone in person, I set it up with the trooper. We talk about what we're going to do. And we go to that call, and then they come back and they dump me back off here, and they go back to their other calls. Because we're rural, it's not like they have backup 5 minutes away. And I'm a liability. As fun and exciting as it might be for me to ride around with a trooper, I recognize that they have an element of having to watch for my safety when they're out there. And I respect that. And I try to limit when I ask them to take me places, to when it's necessary. As much fun as it might be to go ride around and do things, that's not my job. My job is to help with the mental health issues or the elder abuse issues. Um, and so we'll set it up, we'll go, and then they take me back here and they go about their job.
And I think that's probably the biggest difference in Mary Beth's role and mine. And Hancock and Washington County, that is a lot of mileage that they're covering. And for me to go out to, a public housing building that's 5 minutes away from the police station when everybody knows where I am, yeah, there's still like anything can happen in 5 minutes, right? But whenever I go out onto calls by myself, they're typically with people that I've already established rapport with. I do a lot of follow-up work, kind of like case management work. So I meet with somebody and I identify a need, and then I continue to provide that person services over a longer period of time. So I've already established that I feel relatively safe in this home. And the officers for me, for Bar Harbor and Mount Desert, they're very close. I mean, and if I'm somewhere that's more than 15 minutes away from the police station, they're usually out on patrol in that area. And I have a radio and I have my cell phone and I'm in a town car. So that is the biggest difference. And I totally understand why Mary Beth doesn't go out to calls by herself or co-respond, just because the area that they're covering is much larger than mine.
And when you start that initial contact with somebody, how does that work? Do you go with an officer at that time, or how does that work?
Typically the first interaction that I have with somebody, I either do via a phone call or an officer will correspond with me. And the officers are really, really good about being like, you're not going by yourself. We're going with you. So, if ever they feel like, okay, we need to correspond, I don't question that. And we go together, even if it's them waiting outside in the cruiser, because there is this, the uniform alone is just a first level of authority. It creates power dynamic. And when I'm approaching somebody who maybe like has a poor history with law enforcement, or is just already in crisis, if I can avoid not showing up with a uniform and a badge, I do that, because I feel like I get a better response from the person who may already be scared or in crisis. But that being said, if anybody has a history of violence, assault, domestic, really unstable mental health, has been known to grab a knife or something like that, I don't respond alone. I'll at least always have them outside the door, or with me, like physically inside the house. So like I said, I always have a radio with me. I do have a vest. I've really never had to use it. I don't anticipate ever having to use it, but it is just a level of safety that's provided to me if I ever need it.
That sounds really good. And Mary Beth, how does it work for you being mainly in your office so you don't get that kind of contact with people? Does it like work on the phone well, or?
It actually does. I feel like what will typically happen is the trooper might respond to someone at 2 o'clock in the morning and say, we have a behavioral health coordinator. Is it okay if I share your information and number with them and they'll reach out to you tomorrow? So they'll sometimes preface that so the person will know that I'm going to call. Sometimes they don't. But typically if I can get their number, and I've been harping on my troopers for so long, like get contact numbers and put them in the CAD so I can call and I don't have to email you and harass you. They're good at that. So they'll remember to not only that I exist and that I'm a resource for them, but at 2 o'clock in the morning, they can mention it to the person. Then the next day I can follow up and then talk to them about the details of why they ended up calling the police. What can we do? And try to problem solve with them, and sort of walk along them with that. As opposed to telling them what to do, I really always try to focus on asking them what they want for help, if they want it. And then if there's a resource that I think of, I'll say, would this be something you'd be interested in? I can make referrals without permission, but I tend to not do that, mostly because it's just, it's a respect thing. I don't like to just refer someone to options and move on. I would like to tell them I'm going to make a referral and this is why, and then get their permission. But I don't always need their permission to share information, which is completely different from me coming from an education world where you need permission to do anything. So, yeah, it's been a lot of learning to navigate some similar systems that I was familiar with before, but from the law enforcement perspective, and recognizing that when you show up at someone's house and you say you're with the Maine State Police, there's some strong reactions from people, and the troopers are used to that and they know how to deal with that. And when it's happened to me a few times, I'm like, oh, geez, I'm just like standing here not armed, and I hope they're not upset. So yeah, it does make you really think more about, how people react to the police, and their own feelings and past history with the police will affect how they react to you. But when I call them on the phone, it's usually, I would say most of the time, very positive.
One of the things that I talked to the officers about when I first came here, when I wanted to, respond to situations that I felt were safe for me to respond to alone, they were like, no, you're not going to go by yourself. And I explained to them, I come from crisis. I come from the Maine State Crisis Line. I'm responding to people's houses in that role all the time, extremely mentally ill people. I'm going to their houses, and I don't have police officers that come with me. So I'm very trained in how to interact with somebody, especially like somebody mentally ill, without an officer. Like, don't let anybody be between me and the door. I'm always in between the person and the door. Like, I always have an exit, things like that. And they really kind of understood, okay, well, if she trusts herself, then we're going to give her a little bit of trust in her too. And it's worked out. It's worked out good so far. But
That's
sometimes I
super.
wish I didn't have to. So I'm like, oh, just sitting and making referrals over the phone. That would be really nice. Instead of, some of the types of things I do. There's a girl in our community who has severe paranoia, and anytime she goes into a public place, she has a panic attack and she can't make it through getting groceries. So I went to the grocery store with her. I wanted to witness, okay, what does this look like? I wanted to see firsthand what is her experience in the grocery store, because she tells me about it, but I need to kind of see what happened. So those are the types of things that I do. Like I spent 30 minutes trying to help her get through the grocery store without a panic attack. That was a very safe situation. In my opinion, we were in a public place, and she struggled. It was actually it was worse than I thought it would be, but yeah. So those are the types of things that I do also when I respond alone.
And that was so helpful, especially what you said about that people in other fields are doing these kind of visits all the time. And that there's training that goes with that to be able to do that safely. So it's not like it's a new thing nobody's been doing to provide that kind of support to people in person also.
Yeah,
The difference is
I-
now the Bar Harbor Mount Desert Police Department are responsible for my safety. So I totally get why they don't want me to go into any situation that's unsafe, because they're like, no, you are ours, you are one of ours, you are one of us. And if anything goes wrong or feels wrong, we will be there in 2 minutes, type of thing. So they do really kind of worry sometimes, but I get it. They are responsible for me ultimately.
Yeah, I did home visits for 10 years before I came here, and I was in some severely sketchy situations that were dangerous. And I had no training other than my husband telling me how to handle stuff like that informally. My other employer was just like, "Oh, if you feel safe, you should leave." It's like, yeah, well, you haven't been in a house where they're cooking meth in the kitchen and then they recognize that you see that. And I was alone. But in this position, I am identified as the Maine State Police, and that comes with a different um, security risk. And so I recognize that and I respect that. And I still feel like there are times when I really, really, really wish I could just go and do something in person and follow up. But I'm working on my lieutenant. I'm wearing him down a little bit. And there's some times when he'll like, okay, yes, you can go to the hospital and see this person who you've worked with before because it's the hospital. So I don't have to have, I call it a babysitter, but they call it an escort, so that I can do some of those follow up things without needing to drag a trooper into something that's very, very low risk. So we've worked on it, but I still understand and respect the safety concerns that they have. So.
And ultimately, they're just different models. One way isn't necessarily better or or not as good as the other way. They're just two completely different models of how to provide this service.
Yeah. We've had some issues with crisis response, having some challenges with the way the police respond to some of the calls they've asked for them to come to. So I've worked on trying to sort of bridge that, because they're two very different models of how to deal with people that are having a mental health crisis. And I'd like to see some more work happen between the law enforcement and the crisis response so that they can better understand each other, but also to collaborate more, because I know the need is there. And a lot of times it's just a misunderstanding or a miscommunication. But I don't like to see it when people are frustrated and they're like, oh, those troopers, they just don't know how to deal with people that are in mental health crisis. I'm like, no, they're not trained to deal with people in a mental health crisis. And that's why you're here. And it's a misunderstanding or it's a miscommunication. So I'd really like to see that evolve.
One of the things that seems like something that slows down this kind of community support model is that folks who are running departments are afraid for the safety of the people who would be providing that. And I wonder if there's more that you might say to that, or do you feel like it's kind of that's covered in everything that the two of you have said already?
No, it's a legitimate concern. It's a huge liability to take an untrained civilian into an unknown situation. Because, especially not just looking at the mental health thing, any situation can go to hell in a handbasket very quickly. And you don't always have the ability to predict that. But the law enforcement, they are trained to be prepared for that. And a civilian doesn't necessarily come into it with that kind of a mindset. So it is, in some ways, a liability to think about taking someone on that might have fantastic skills with the mentally ill and have a ton of resources and be very useful. But to take them out into the unknown situation, there's always an element of risk. So I think it really depends on the philosophy of each department on what they want to get out of it. I could say it's going to be useful for everybody, and any department could benefit from a mental health liaison, but it's how they use them. And I think there are different models of response that different departments might choose to use. It's just understanding that it doesn't always have to be the exact same, just the way Melissa and I work in similar capacities, but in different models of response.
So what would that look like, those different models?
Well, like Bangor PD has someone that goes out and rides with an assigned police officer, and they are in the cruiser for the entire shift. They work evenings, they work swing shifts. They're embedded in the police department with that police officers. They are out on calls, and they try to send that person to any mental health calls. And sometimes they end up on a call that's completely not related to mental health. So that liaison is sitting in the car doing whatever it is that she would do from the office from a police cruiser. Penobscot SO has a clinician that's embedded with them, and she is an actual clinician. So she can go in to a crisis and talk to people, provide counseling. So there are different levels of training and experience and education that each liaison might bring. So, I'm not a clinician and I cannot provide counseling, so I don't do that. But there are others that work as co-responders that might have those credentials and they can do that.
Is there like a central resource of folks working on different ways for departments to use this? Like say if somebody who is part of a department that doesn't have a mental health liaison, is there something that's an especially good resource to go and see some of that laid out?
Funny you should mention that. The lieutenant that's in charge of our program, Aaron Turcott, is actually talking about developing a one-day, sort of like a conference where they'd invite sheriff's departments, police departments, municipal departments to come and sort of chat with us and other liaisons to sort of get a feel for what they can do for their departments, and sort of like almost like a job fair, kind of a model where you could come and talk to us, look at the model we've developed, also talk to other police departments that might use a co-response model or a liaison, and then they can use that information to take back and make an informed decision on, do they want to provide this service? What would it best look like in their community? And really make an informed decision based on the different types of models that there would be. So.
Cool. That's
And
really
this is
good to hear.
this is a little kind of off that a little bit, but as far as new departments getting liaisons or behavioral health specialists, there is a place in Auburn. It's called Dear Go Safety. It's a training center that's mostly for law enforcement, corrections officers, things like that. And they provide it's a one day, I think it's like 8 hours long, but they provide a training specifically law enforcement mental health liaison training for an 8-hour period of time. So that is a resource for any of the police departments that do want to bring somebody on, to send them out there to get a little extra training for specifically for the work that they're going to be doing.
That's excellent. Do you have a link or something for that maybe after we're done, could you send it to me and we could post that together with the recording for this talk? And the same thing, Mary Beth, if your lieutenant starts to put that together, what you were talking about, we could help to publicize that.
Absolutely. Yeah, when we get that more formalized, I'll definitely keep you in the loop.
Okay, wonderful. I feel like I've been taking up a lot of the space asking a ton of questions here. Who else has thoughts on this discussion? Tara, I saw you take your
Yeah,
knee.
I was wondering, it's especially for um Chief Beers and Melissa and Mary Beth, is there anything that community service providers could provide for training? Um, I know I have some training that I can provide that I think might be helpful for law enforcement people, but I know it's so hard for officers to get to training because they're short-staffed and it's hard to set aside. So is there any training that would be helpful? And if so, what is the length of time that would be most feasible? Like 1 to 3 hours, a half day, a whole day? And what are your thoughts on that?
I know for us, I mean, I'm not really sure where Glenn stood, what he had talked to you about as far as moving forward with a mental health liaison within the department. I'm just kind of getting up to speed on this, but I know for us, I mean, it's gonna depend on how much information you can get in the time period. I mean, I don't know if you can set a time on it. I will say sometimes, you know, police officers don't want to sit in a room for 3 hours when it can be given to them in an hour. So
I get that.
I mean, I think it would depend on what you guys or who was conducting this was appropriate that we need to know. I mean, obviously I would assume that Glenn had some conversations about us, getting somebody in your capacity in here, but, because obviously there's a need for it now. I don't know, I know somebody mentioned earlier, I don't know if 90% of our calls, involve that, but the number is definitely high. And it would be a benefit. And, you know, the other thing is we also, you know, like Mary Beth was saying, and Melissa, yeah, there is a safety concern for all of us, right? That's always in the back of our head. And I know guys just think like, well, there's somebody else I gotta watch out for. And I think like Mary Beth said, I mean, if you can show that you're not somebody that we gotta babysit, you're somebody that's actually gonna help us, then yeah, that's definitely. And I think maybe, I mean, those are probably different types of training. I mean, there's a training on what you do and what you can do, then there's the training for us, our aspect of what we're bringing somebody from outside in to involve them. But, you know, I think whatever you had for, just as long as the training was geared appropriately to what we're talking about and, you know, whatever time you think it takes. I will say, I mean, if there is something going on, we have a new facility here, obviously, we have a pretty large training room. So if you're thinking about getting something together, you let me know a date and a time and number of people. I think we can facilitate probably 20 people. We can probably help out with that aspect of it. But again, it's new to me, so I'll keep updated and maybe I can get send me some emails on what you plan on doing so we can talk about it with the command staff and stuff and get some involvement.
Great.
One other thing that I was going to say about trainings, it's just kind of a little bit of an option. It's something that I can even do like through the chief or the captain. If I have some like, let's say information that I think would be kind of valuable for the officers to read, like how to respond to disorganized thinking. That just popped off the top of my head. But like skill set, I can just filter that through the chief and the captain, and they can put it on like Power DMS or like DHQ. They can put it on like one of those portals that the officers use, and they would have to read through it and sign off it. So it's not like the same as like a 1 or 3 or 8 hour training, but it is useful if it's just like a small amount of information that I think is helpful. And then they would have to read through it just like a policy and sign off that they've read that information.
Yeah, I'm sneaky. I'm like, yeah, they're never gonna read it in DMS, so I'll just send them an email. A lot of times I know that because of the way shifts go, they're not all gonna be available or wanna come to a training. But if there's information, and I just sent out an email to most of the troopers, like, hey, it is super helpful when you can do this when you're responding to parents with an out of control teenager. Just to set the tone, it makes your job easier. If I can find a way to work it in that it's gonna make their job easier, they're more likely to read that email. But then if it's more than 3 lines, I'll get a response from some smarty pants that'll be like, your emails are too long. Like, come on. It's just to try to help. But yeah, the training I think is, if you can find a way to make it useful for them and then condensing it, it's going to be more effective. If you tell them they have to do a day-long mental health training, they're all going to be calling in sick. So I've tried to find workarounds to introducing some little tips and tricks to, working with the mental health issues. But yeah, it's all, I personally love to go on all those trainings. So Tara, loop me in on the email and I would absolutely love to be involved in that.
Yeah, that's been my experience too when providing that type of training for the military, because we've always been, we're not people that can sit still for an hour even. So it has to be really active. There has to be a lot of getting up, and it has to be very practical and skills oriented. And that's why I like to ask, I would always ask commanders, I have this menu. What do you think is most relevant for your people? What are they going to be most engaged with? And let them pick and try to get something that they're going to be the most interested in, rather than just like be like, I think we're going to do this year, and then provide the same training to every unit. So
I would say pair it with a range day and they'll all be there.
I've done that before, and that's
An
good.
hour worth
It's
of
so good to
range,
do something while
an
they got the
hour
downtime at the range. Yes,
training,
absolutely.
and
That's a great idea.
flip flop back and forth. You won't lose them.
Yep, that is a really good idea.
That's great.
So I will say, when we do like when we do our training, we have a full training day and, to incorporate something in on those range days. Yeah, we might be able to do that. It would be a 15-minute, half-hour type thing, but yeah, you got everybody's attention and they're paid to be there, so it might.
Yeah, that's really good.
I hate to leave, but I got another meeting I gotta go to. I guess send me the email with the links and stuff that you were talking about earlier. And
Yep.
let me know.
Yep.
Great.
Pleasure meeting you
you.
all.
Thank you.
Nice to meet you too. Thank
All
you
right,
so much for
have a good
coming. All right. Take care.
I have another meeting as well.
I
Do
do
you?
too.
Okey
Thanks
doke.
for
Thank
joining
you.
us. All right. Have a great day, everyone. Thanks, Mary Beth. That was so wonderful.
Oh, thank you for having me. I always like to talk up my program. So
Yeah,
Yeah.
that
Nice to
was
see
really
everybody.
very informative. Thank you.
And Suzanne, what do we
And
need to do right before I shut off the recording? Is
Uh,
there anything?
no, just
say?
that if anyone wants more information about the LECEC, that they can go to the website, lecec.org. And we're working on trying to get it as up to date as possible, which we're working on it.
Yeah. I have one final thought. We send child protective workers out into this type of situation every day too, without law enforcement backup frequently. So we do kind of have that community model. I'm wondering if that could be, I feel like there could be a bigger conversation system-wide at some point around people who respond to people in crisis from a social work model or a law enforcement model, and how we can maybe smooth out that continuum somehow system-wide. I have not a very, very well formed out thought on that, but it's just something that this conversation made me think about.
I do know that the APS people will be like, why are you not going out? Like, I'm going out alone. They will sometimes, DHS will sometimes call for an escort, a trooper
Mhm.
escort, if they have to do something that's considered dangerous or risky, or if the person has a history. But you're right, they do respond to a lot of people's homes, and then they're unannounced too.
Yeah.
They'll just
And
show
then a lot of times they will respond alone without police escort because they're told nobody's available and they're told to go anyway.
Mhm.
Hmm.
I did that for 3 years, and it's not as dangerous as you think it would be most of the time, but sometimes it is. And sometimes it is like, it is so scary.
Mhm.
And they're doing that every day.
Yeah.
I wish there was more of a tiered response. Like, I think we have law enforcement, we have maybe para law enforcement, and then we have peer social work. And there should be some sort of and maybe even more than three, there should be some sort of like a risk matrix for deciding who goes.
We're actually looking at developing a risk matrix for our positions so that we can try to justify being able to come out and do more of those in-person things.
Yeah.
So it's definitely something that I agree is needed, and it's just developing a risk matrix and how do you
Absolutely.
predict behavior. And a lot of times you can look at past history, you can look
Mhm.
at certain things, but there's always that element of you never always know for sure.
Yeah, exactly.
So yeah, that's what makes it tough.
It is, it really is.
So there's both a structural issue about that some folks who are going into these situations aren't as protected as they need to be. That's not through community liaisons, but for example, Child Protective Services.
Well, and the training that they
And
get provided is different too, and it should be more, I came into child protective work with a military background, and I was like, they definitely could have provided better training on how to be safe.
Mhm. So I'm just looking at the kind of two aspects of it, thinking about things that people have said to me about, oh, this isn't safe. We don't want to set up a community liaison program because it's not safe for those individuals to go into these situations. So, so there's that folks are doing this already in other contexts, but
Yeah.
that doesn't necessarily make it okay that like
Well,
you were
most of the
getting
time
into
it is
those.
safe though. Most of the
Mhm.
time. I'm
Okay.
saying the vast majority of the time when I was a child protective worker, I did not feel unsafe at all.
Mhm.
The vast majority of the time going out to see people in crisis and seeing people with mental health issues felt just perfectly fine. Like maybe, stressful, but not unsafe.
Mhm. Mhm. That's good background to have.
Yeah. And they are doing it every day, every single day.
Mhm.
So we have people doing that in the community every single day, responding unarmed with no training or very little training. Of course, it's been 20 years since I've done that, so I don't know what kind of training they're getting now, but yeah.
And what kind of training would you like to see for people going into that situation?
Well, I think police need more training on just the mental health aspects and how you deal with different mental health crises, and people in social work like child protective workers need more training on like the basic personal safety, like don't get between, the door, make sure you have an exit, that kind of thing.
Mhm.
So I think there's a lot of benefit for police officers to get training in mental health and for people doing social work to get training in like more of the physical, like how do you keep yourself safe? And maybe even I would provide them with some of the training that police officers get for, just like, we didn't ever get any training on like how to get out of a hold if somebody grabs you. That was never provided. That would have been useful.
Like
The few days of
self-defense
that would
training.
be super helpful, I think, for child protective workers.
So
It never
in
happened, but you'd feel more comfortable, you'd feel more safe going into a situation.
Mhm.
Not saying it never happened to anybody, it never happened to me, but I think
in
that would be
my
useful.
role, I did have the opportunity to go to a MANT training,
Yeah.
which
Mhm.
is, I mean, I don't anticipate ever like having to use physical force in anybody, but they did provide that opportunity for me to go and get a little bit of training in that. And that was kind of nice. I think also a good skill for people to practice when going into potentially unsafe situations is really just like good conflict de-escalation
Mhm.
skills. You
Absolutely.
can oftentimes talk your way out of conflict.
Oh,
But then also like the thing that I just never forget is like don't have anything between me and the door. Not
mhm.
a person, like
Mm.
nothing. So I think you're right. More training
Mhm.
for people that are being asked to do these jobs that, or not even asked to, that are just doing these jobs
Mhm.
that put themselves potentially in harm's way. The more skills, the better.
Yeah.
And that there are so many benefits to having people in these positions with the various law enforcement departments too. I don't want to overshadow that with, oh, how does one deal with the risk? There's that the benefits of doing it are enormous, and we see it growing, like that the state police in Maine is doing this now, and Bar Harbor Police Department for you, Melissa, and different departments. The sheriff's department in Waldo County has a really strong program as a community liaison that we have a talk about if anybody's interested in that. If you look back at the Law Enforcement Community Engagement Committee recordings, Waldo County came and did a really substantial talk with us about how their program works and how they funded it and um, all kinds of stuff about it.
Well, and I think
So,
overall this reduces risk because I think people do respond in different ways to a law enforcement and not always the same way. Like some people are going to try to get violent with a social worker where they wouldn't do that with an armed police officer, and vice versa. Some people will get violent with an armed police officer. Sometimes sending the right type of response and trying to figure out what that type of response is, having the right tool for the right job is important, and having the right response for each situation is important. And we should have a variety of response options in our community. And I think that would be ideal.
that sounds so good. Well, thank you so much, Mary Beth, for coming to talk, and Melissa for being here and adding what your job is like. This has been super helpful. And I'm gonna go back to the record thing and shut off the recorder. And thank you, Suzanne, for helping so much with this meeting. All righty.
I hope you're feeling better, Shemaya. Have a great afternoon, everyone.
Thank you so
You
much.
too. Bye-bye.
Okay, bye-bye, everybody.